This conference will now be recorded.
Good morning, one and all. I am Assistant Professor of General Medicine. Today, my topic of discussion is viral hepatitis. The first virus discovered to cause viral hepatitis is yellow fever virus, followed by discovery of hepatotropic viruses. What is viral hepatitis? Viral hepatitis means infection and inflammation of liver parenchyma by virus. The most common virus discovered to cause viral hepatitis are hepatotropic viruses. Hepatotropic viruses are named as hepatitis A, B, C, D, E. Among these, the most common cause of acute hepatitis is hepatitis A. The most common cause of chronic hepatitis in India and in tropical countries is hepatitis B. Why these are called as hepatotropic viruses? Because they take nourishment and multiply in liver parenchyma. Apart from all the viruses, because viral infection is a systemic illness, virus can replicate in any part of our body. But these hepatotropic viruses multiply only in liver parenchyma. That's why they are called as hepatotropic viruses. Other viruses causing viral hepatitis are herpes simplex, cytomegalovirus, Epstein-Barr virus, yellow fever, and else something. Hepatitis means, as I said, that is inflammation of liver parenchyma. Acute viral hepatitis, that is the time limit to distinguish between chronic and acute hepatitis is 6 months. Acute hepatitis is infection lasts less than 6 months is called as acute viral hepatitis. If infection lasts more than 6 months, that is called as chronic hepatitis. The natural evolution of hepatitis in a chronic hepatitis is first patient develop acute hepatitis, then patient develop chronic hepatitis, followed by cirrhosis, followed by hepatocellular carcinoma. Among these, fulminant hepatitis means there is a severe necrosis of 90% of the liver parenchyma leads to fulminant hepatitis. Fulminant hepatitis is a lethal condition. Patient dies within days. But acute hepatitis and chronic hepatitis, in almost 90% of the patients infected with acute hepatitis will recover. These are the different types of hepatotropic viruses, that is hepatitis A, B, C, D, E. Among these, only hepatitis B is double stranded DNA virus. Remaining all are single stranded viruses, single stranded RNA viruses. Hepatitis A virus comes under Picornaviridae family. Hepatitis B comes under Hepadnaviridae family. Hepatitis C comes under Hep C virus. Hepatitis D is a Delta virus. Hepatitis E is a Hepiviridae, comes under Hepiviridae. Among these, hepatitis A and E have fecal route of transmission. Rarely they transmit to parental route. Remaining hepatitis B, C, D are major route of transmission is parental. They are not transmitted to fecal route. Children are frequently affected in hepatitis A, and young adults are frequently affected in viral hepatitis C. Hepatitis B, C, D can affect any age group because adults are immune to viral hepatitis A and E. Carrier state seen only in hepatitis B and C. That means the hepatitis B and C are chronic forms. That's why there are carriers are available in hepatitis B and C. There is no carrier state for hepatitis A and E. The average incubation period for viral hepatitis A is 25 to 30 days. For hepatitis B is 50 to 180 days. For hepatitis C is 40 to 120 days. And hepatitis D is 2 to 12 weeks, and hepatitis C is 2 to 9 weeks. Among these, chronicity or chronic infection or chronic hepatitis is seen only with hepatitis B and hepatitis C and hepatitis D. Hepatitis D only infect patients with hepatitis B. Isolated infection of hepatitis D is rare, very rare or negligible. No. There are vaccination available only for hepatitis A and hepatitis B. There is no proven vaccine or discovered vaccine for hepatitis C, D, and E. That's why hepatitis A and B are vaccine preventable. Hepatitis A, also known as infectious hepatitis or epidemic jaundice, because hepatitis A comes as epidemics in children. A group of children affected in a particular region. That's why, or it comes as a wave. That's why it is called as epidemic hepatitis or infectious hepatitis. This hepatitis A is not lethal in normal individuals, but hepatitis A can be lethal in very immunosuppressed individuals like malnourished or chronic alcoholics or HIV patients. The patient presented with non-specific constitutional symptoms like fever, chills, headache, fatigue, generalized weakness, and body aches and pains, because there is an increased production of inflammatory cytokines like in interleukin 6, necrosis factor alpha, interleukin 1. These are pyrogenic cytokines. These cytokines cause these features like fever, chills. These are called as constitutional symptoms. Constitutional symptoms are caused by inflammatory cytokines released secondary to viral infection. This hepatitis A virus is not lethal. That's why it is benign disease. Hepatitis A comes under Picornaviridae family. It is one single stranded RNA virus without any envelope. It is a naked RNA virus. It is heat resistant. It withstands heating up to 60 degrees for 1 hour. The effective disinfectant for viral hepatitis A is formalin. There are only human reservoirs for this infection. There is no animal reservoirs. The crucial period of infectivity is 2 weeks before the onset of jaundice and 1 week after the onset of jaundice. This is the crucial period. An infected person can transmit infection to fellow members. The major route of major infective material is man's feces and contaminated water and uncooked or raw food. Virus excreted same to period of infectivity. Virus excreted 2 weeks before onset of jaundice and 2 weeks after the onset of jaundice. We can isolate the virus in human feces or patient feces. Only younger people or children are affected with hepatitis A virus, because adults are because of herd immunity. All the adults have antibodies against this hepatitis A virus. That's why adults can't be infected with this hepatitis A virus. Both the sex incubation period is around 10 to 15 days. The major route of transmission is fecal-oral route. Very rarely patient blood can transmit through accidental skin puncture during procedures in healthcare workers. Diagnosis hepatitis A virus is done by either demonstration of viral particle by immunoelectromicroscopy in feces, blood, or bile, or virus isolation by culturing the virus, or detection of antibodies by ELISA, and to estimate the extent of liver inflammation by ordering tests like liver function tests. Those are serum bilirubin, albumin, AST, ALT, ALP. All of those are indicative of viral infection. In viral infection or hepatitis C, due to inflammation of liver parenchyma or inflammation of liver hepatocytes, these enzymes are released into circulation. That's why these enzymes are elevated in patients with hepatitis A virus infection. The drug investigation of choice or gold standard investigation of choice for diagnosis of hepatitis A virus is RT-PCR. This is the time course during which appearance of symptoms or appearance of immunoglobulins in a patient blood infected with hepatitis A virus, also known as natural course of the disease. Initially, within 2 weeks, there is viremia. Viremia means circulation of virus in the blood. Within 2 weeks, there is a excretion of virus in feces, and we can isolate the virus from patient's blood within 2 weeks. That is 2 weeks before the onset of jaundice. That is elevation of serum aminotransferases and elevation of serum bilirubin. This is a landmark. Before 2 weeks, we can identify virus in blood and identify virus in feces. And we can isolate a virus up to 1 week after the onset of jaundice and 2 weeks after the onset of jaundice in feces. The first appearance of antibody against hepatitis A virus is IgM, followed by IgG. Once IgG appears in the serum or blood, patient is recovered from the infection and not infectious to the others. Hepatitis A virus is a preventable disease by taking environmental measures like hygienic measures and sanitation. And we can immunize the patient. We can give vaccine either by active immunization or passive immunization. By active immunization, we have to give hepatitis A virus vaccine. By passive immunization, in a patient with immunosuppressor individuals or HIV patients or malnourished people, we can give immunoglobulins to suppress the disease or to reduce the severity of hepatitis. There is no proven antiviral drugs discovered till date to eradicate hepatitis A virus infection. Mostly symptomatic therapy, because almost 99.9% of the patients recovered from hepatitis A virus without any lethality or without any deaths. Coming to hepatitis B virus, this is the most common chronic hepatitis infection in endemic regions like India and China. Hepatitis B, also known as serum hepatitis. The major route of transmission is parental route, that is accidental needle punctures or contact with the body fluids of patient or close relatives. This hepatitis B can be transmitted. This virus can 90% of the hepatitis B virus infected patients are hepatitis infected patients can develop acute hepatitis. Only 10% of the patients, 5 to 10% of the patients can develop chronic hepatitis. That means 90% are recovered from acute hepatitis and leads normal life. Only 10% of the patients develop chronic hepatitis or cirrhosis of the liver. Similar to hepatitis A virus, the acute course of the illness similar to acute hepatitis A. Any acute hepatitis A have similar presentation like jaundice or constitutional symptoms. It is one of the commonest cause of hepatocellular carcinoma in Indian population. Hepatitis B. If hepatitis B along are co-infected with hepatitis C virus, there is a multiple fold increased risk of hepatocellular carcinoma. The most common cause of hepatocellular carcinoma in Indian people is hepatitis B virus carrier state. Hepatitis B is endemic throughout the world. It is a complex 42 nanometer double-stranded DNA virus. It replicates mostly it replicates in liver cells. It has three forms. One is a small spherical particle, average diameter of 22 nanometer. One is elongated or tubular structure, that is 22 nanometer diameter, and a Dane particle. Dane particle is very important viral particle. It only Dane particle can infect the other persons. Only Dane particle is a viable particle of the HBV virus because it contains double-stranded DNA virus. This is the double-stranded DNA of hepatitis B virus. With the characteristic feature of hepatitis B virus is it is almost double-stranded, but it is a partially single-stranded DNA with double-stranded DNA combination. That's why this is known as Dane particle. Dane particle means double-stranded DNA of hepatitis B virus surrounded by bi-enveloped virus. This is the infectious form of hepatitis B virus because it has DNA particle. These spherical and elongated forms don't have DNA material. That's why they are not infectious to the other persons. These particles are not infectious. Only this hepatitis B virus is infectious to the others. This is a three-dimensional structure of Dane particle. There is a double-stranded DNA with the DNA polymerase surrounded by two envelopes. The diameter of Dane particle is 42 nanometer. Remember, this is very important. Here also, most of the time, hepatotropic viruses have reservoir of infection only humans. Most of the time, apart from hepatitis E virus. Hepatitis E virus can have reservoir in pigs. The major route of infection is contaminated blood or contaminated body fluids of the patient. It has the disinfectant of choice for hepatitis B virus is sodium hypochlorite. Almost 90% of the patient develop acute hepatitis, resolved over a period of time recovered. But only 2 to 10% of the patients can develop chronic state or chronic hepatitis. Among these chronic hepatitis patients, only 3% of a chronic hepatitis patient can develop chronic hepatocirrhosis. These are the high risk groups get infected with hepatitis B virus. People from endemic regions like India, and babies of mothers with chronic hepatitis B virus and intravenous drug usages because they share needles. These needles are a source of contamination. And people with multiple sexual partners and hemophiliac and other patients requiring blood and blood products. Most of the hemophilics before 1980s and 1970s, they are getting infected with hepatitis B virus or in HIV virus because they need repeated blood transfusion or repeated blood component transfusion like FFP. Before 1970, there is no ELISA. After only 1970, there is a discovery of ELISA. This ELISA, we can isolate the patient with hepatitis B virus and hepatitis E, and blood components infected with. We can isolate blood component infected with hepatitis B or HIV virus. That's why patients hemophiliac live before 1970 or 1980. They are most of the time infected with hepatitis B and hepatitis E virus. And healthcare workers, healthcare personnel in close contact with hepatitis B patients are doing any procedures like IV punctures, leads to patients accidental injury with needles can get hepatitis B virus. These are the antigens and antibodies we can isolate from patient's blood. The first antigen we can isolate is HBsAg. This HBsAg is also called as Australian antigen. Followed by hepatitis C antigen and hepatitis E antigen. Hepatitis E means envelope antigen. C means core antigen. This hepatitis C antigen we cannot isolate from the patient's blood. We can isolate this hepatitis B core antigen only from liver parenchymal cells, because this hepatitis C antigen not circulated not circulates within the blood. Average incubation period is 60 to 90 days. These are the modes of transmission. Main route of transmission parental, followed by sexual, followed by perinatal, or perinatal also known as vertical transmission. That is transmission of hepatitis B virus from mother to baby. These are the laboratory investigations we can order in a patient with hepatitis B virus. First, serology. Serology means we can isolate the patient antigens. Hepatitis B, HBsAg antigen, HBcAg, HBeAg, and antibodies like IgM anti-HBs, IgG anti-HBs, and IgM anti-HBe, IgG anti-HBe. And to assess the extent of liver inflammation, we can order for liver function test. And we can isolate HB viral DNA. HB viral DNA means it indicates the quantity of quantity of infection, how much viral load. If patient has excessive viral load, that signifies severe inflammation. Very rarely liver biopsy is performed. Today's world, in a new 21st century, there is no role for liver biopsy, because liver biopsy has many complications. It can cause bleeding, and the patient goes into shock. These are the serological markers of hepatitis B virus. Those are HBsAg, anti-HBs, anti-HBc, IgM and IgG, and HBeAg. This HBeAg, persistence of presence of HBeAg in a patient with the hepatitis B virus infected patient indicates virus is actively replicating. That means presence of HBeAg means virus is actively replicating. A patient is highly infectious to the others. This is the natural course or appearance of immunological markers in a patient infected with hepatitis B virus. First antigen appears in the blood is hepatitis B surface antigen, followed by hepatitis B AE antigen. There is no, we cannot isolate hepatitis C antigen from patient blood, because it stays only in liver hepatocytes. It can if at all present, this hepatitis C antigen is covered by surface antigen or envelope antigen. That's why antibodies are not against hepatitis B antigen. That's why we cannot isolate hepatitis B core antigen. We can isolate only HBsAg and HBeAg. Over a period of 12 weeks, there is a first antibody to appear is anti-HBc. First antigen appeared in hepatitis B infected patients is HBsAg. First antibody we can isolate, or first antibody appeared in patient blood is anti-HBc, IgM anti-HBc, followed by IgG anti-HBc. Following anti-HBc antibody, there is anti-HB. We can isolate around 20 weeks. We can isolate anti-HB. Lastly, anti-HBs. This appearance of IgG anti-HBs indicate patient recovered from the infection. Any patient with IgG anti-HBs, patient we can isolate anti-HBs antibody in a patient with infected with hepatitis B. That means patient is recovered. This patient is no longer infected to the other persons. This is the interpretation actually. That means presence of HBsAg, presence of HBeAg means there is an active infection. Patient have active infection. he can infect you to the others. Presence of IgM antibody. This IgM antibody means IgM developed in acute situations. Presence of IgM, presence of HBsAg, presence of HBeAg indicates acute hepatitis. Presence of IgM indicates acute hepatitis. Presence of IgG indicates chronic hepatitis. Okay, similar pattern, but presence of IgM indicates acute hepatitis. Presence of IgG indicates chronic hepatitis. If patient develop antibodies to HBs and the presence of anti-HBs means there is recovery. Patient is recovering from infection. Almost if only we can isolate only anti-HBs, that means patient is recovered from hepatitis B virus infection. If a patient have equivocal anti-HBs or equivocal anti-HB indicate that is a chronic carrier state. Okay. This presence of IgM and IgG with or without presence of anti-HBs means there is carrier state. This is a vaccine preventable disease. That's why we have to give every person must have hepatitis B vaccination. We can give hepatitis B immunoglobulins. Those patients they have accidental exposure, like healthcare workers getting infected with needle punctures. We can give hepatitis B immunoglobulins. The dose of hepatitis B vaccine is 0.5 ml. It is given at a dosing schedule of 0, 1, and 6. At 0 dose followed by 4 weeks, followed by first dose, followed by after 6 months in another dose. Total 3 doses. But one is 0 dose. 4 months, 4 weeks after 0 dose, second dose. The 6 months or 5 months followed by second dose is third dose. These are the drugs discovered to prevent or treat the hepatitis B virus infection. These are interferon alpha, lamivudine, edifovir. There are many new recent drugs discovered to treat hepatitis B virus infection are tenofovir, entecavir, telbivudine, lamivudine. Coming to hepatitis C virus, similar to hepatitis B virus, the clinical picture and the clinical features of hepatitis C are similar to hepatitis B virus infection. It has apart from hepatitis B virus, this hepatitis C virus have highest predilection to develop chronic hepatitis, because almost 60% of the patient, almost 50 to 80% of the patient infected with hepatitis C can progress to chronic hepatitis, but only 10% of the patients infected with hepatitis B virus can progress to chronic hepatitis. But in hepatitis C virus, almost 80% of the patients getting infected with the hepatitis C virus progress to chronic hepatitis. That is the particular feature of hepatitis C. That means hepatitis C have chronic infection, but it is most of the time patients are infected are asymptomatic. They don't develop any features of acute hepatitis. That's why these patients are indolent. Only accidental if we screen the patient blood for blood donation, then only we can isolate the hepatitis C patients. Otherwise, they present our clinics only in a state of chronic state, or patient develop hepatocellular carcinoma, or patient develop cirrhosis. Only after developing cirrhosis or hepatocellular carcinoma, patient present to our clinics. This is a enveloped virus with a single standard RNA. The diameter of hepatitis C virus is 50 to 60 nanometer. Among all hepatotrophic viruses, this is the largest virus. It comes under Flaviviridae family. It comes under Hepaci genus, Hepaci virus genus. Modes of transmission similar to hepatitis B virus. Same. The mode of transmission is similar to hepatitis B virus. The average incubation period is 40 to 120 days. The diagnostic panel or serological markers of hepatitis C virus are HCV antibody, HCV RNA, and HCV antigen. HCV RNA is a quantitative marker. HCV antigen is a qualitative marker of hepatitis C infection. There is no vaccine. There is no. Hello, am I audible? Okay. Vaccine is there is no vaccine discovered till date for hepatitis C virus infection. There are many drugs discovered to treat hepatitis C virus infection. These are interferon and ribavirin, but there are many recent drugs discovered like decletarsevir, velpatasvir, sofosbuvir, semi-previr. All of those are newer drugs to treat hepatitis C virus infection. We can effectively treat the hepatitis C virus infection, but there is no vaccine discovered for hepatitis C virus infection. Coming to hepatitis D virus, this is a parasite virus because hepatitis D virus survive only in the presence of hepatitis B virus. Because hepatitis D virus is a non-enveloped virus, it needs envelope from hepatitis B virus. So hepatitis D infects only patient with hepatitis B virus. That's why it is called as satellite virus. That means it replicates only in the presence of hepatitis B virus. That's why isolated infection of hepatitis D virus is never seen. Mode of transmission is same to hepatitis B and hepatitis D. Incubation period is 2 to 12 weeks. There are two terms for hepatitis D virus infection, that is co-infection and superinfection. Co-infection means simultaneous infection of hepatitis B and hepatitis D are called as co-infection. Superinfection means this hepatitis D virus infect already patient with hepatitis B virus. Serological markers to diagnose hepatitis D virus is delta antigen and anti-delta antibodies, both IgM and IgG antibodies. These are the graphical representation of our course of serological markers in patient blood. Coming to hepatitis C virus is similar to hepatitis A virus. The route of transmission, all the features are similar to hepatitis A virus. But this hepatitis C virus infect young adults and pregnant women. Hepatitis A virus infects only children. This hepatitis C virus is not lethal disease similar to hepatitis A virus, but it can be lethal in pregnant women. It can cause acute fulminant hepatitis in pregnant women, pregnant women. The average incubation period is 3 to 8 weeks. We can diagnose hepatitis C virus by this isolation of IgG and IgM antibodies by ELISA. Very rarely, this hepatitis C virus can progress to chronic infection. Only hepatotropic virus doesn't cause the chronicity is hepatitis A virus. Remaining all the viruses can cause chronicity. But chronicity in hepatitis C virus is very rare. The particular feature of hepatitis C virus is the source of our reservoir of infection can be pigs in hepatitis C virus. Mode of transmission is similar to hepatitis A virus, that is fecal-oral route. This is the natural cause or appearance of virus in stool or elevation of liver enzymes and appearance of an antibodies against hepatitis C virus. This is a preventable disease by hygiene, maintain hygienic methods or environmental hygiene. Hepatitis G virus is very rarely infect the patient, and it is clinically insignificant. There is no patient discovered with developed hepatitis infected with hepatitis G virus, but this name is GB virus. This virus is also called as GB virus or hepatitis G virus. This is clinically insignificant. For the sake of exams, you can remember. It comes under PEGI virus. This is the end of my session. If you have any queries or any doubts, you can type. Where I can type? Show me typing option. అంటే టైప్ చేయడానికి అక్కడ
స్క్రీన్ షేర్ పోయింది.
ఓకే టైప్ చేస్తాను. ఓకే, ఇప్పుడు వీడియో ఎక్కడ బ్లాక్ చేశారు మీరు? వీడియో ఎక్కడ బ్లాక్ చేశారా? అదేంటో మనకు కనిపిస్తాను. స్టాప్ చేస్తారా? ఓకే ఓకే.